going to teach a lumbar canal stenosis today. Now, first of all, we start with what is lumbar canal stenosis. It's a narrowing of the spinal canal in the lumbar region, which compresses the spinal cord or the nerve roots, leading to pain and neurological symptoms. Now, the type of lumbar canal stenosis, there is three main types: central stenosis, lateral stenosis, and columnar stenosis. What is the central stenosis? Narrowing of the spine to the central area. Lateral is the lateral part narrowing, and columnar is the intervertebral column narrowing. Congenital cause is the less common. Narrow spine canal from the birth outside. Congenital scoliosis and the achondroplasia. Now the second type of the acquired cause is the most common, the degenerative cause. Osteoarthritis, also known as the spondylosis, bone overgrowth is complex of spinal cord and the canal. Ligamentum flarum hypertrophy is the weakening of the ligament. Facet joint hypertrophy, enlarged joint, complex and nerve roots. Risk of herniation or the bulging express the nerve itself. Continue with the regenerative dystonia, loss of the wrist height, causing an instability in the spinal cord. Spondylolisthesis, a vertical slipping over the narrow canal. Spinal trauma, like a fracture and the dislocation of the spinal vertebrae. Now the post-surgical changes, scar tissue formation after the spinal surgery. Tumors in the cyst, space occupying tissue, SOL, is also cause of stenosis. Now, what is the clinical features? First clinical feature is the more common, low blood pressure, usually chronic and main radiating to the buttocks and the thigh region. Neurological claudication is the key symptom. Leg pain, numbness, tingling, triggered by walking and standing. Period by sitting, lying down and forward bending, shopping cart sign. Continue with the third, radicular pain inside the car. Painful or dermatome is nerve distribution, commonly occurs the L4, L5 and the S1 nerves. Now the numbness and the tingling, especially in the legs and the feet, often a bilateral because of the central canal stenosis. Now to continue with the muscle weakness, especially in the lower limb of stiffness or swelling, may cause a difficulty in the climbing stay and the walking with your weakness, posture-related symptom worsening with the lumbar extension and the relief with the lumbar flexion, standing upright or walking downhill, improve with the lumbar flexion, bending forward and backward. Continue with the gait disturbance, shorten step, right leg, waist, leg, gait with a weakness and sensory loss. Later